The heart is a vital organ that is located in the middle mediastinum and behind the sternum. 1/3 lies in the right and 2/3 in the left region. It pumps blood to various organs of the body. The blood flow is downwards and forwards, that is, from the atria to the ventricles. The heart is covered by pericardium, which comprises of the fibrous part and the serous part. Let's look at the diagram of the heart. Superior vena cava, this is the inferior vena cava, right atrium, right ventricle, left atrium, left ventricle, the mitral valve, tricuspid valve, aorta, pulmonary artery and pulmonary veins. Let's see this model. So this is the right atria, right ventricle. Right atria receives superior vena cava from the top and inferior vena cava from below, the aorta and the pulmonary trunk. And on the other side, we have the left atria and the left ventricle. External features of the heart. The heart has 4 chambers, the right atria, right ventricle, left atria and the left ventricle. The atria are separated from the ventricle by the atrioventricular groove, also called as the coronary sulcus. The atria are separated from each other by the interatrial groove. The ventricles are separated from each other by the interventricular groove. The heart is made up of apex, base, surfaces and borders. Let's try to understand this in the diagram. Atria separated from the ventricle by the atrioventricular groove. Both the atrias separated from one another by the interatrial groove, and both the ventricles separated from one another by the interventricular groove. So first let's see the apex of the heart. The apex of the heart is formed by the left ventricle. It is directed downwards and forwards. It is located in the 5th intercostal space on the left hand side, and in children it is located in the 4th intercostal space. Now second, the base of the heart. The base of the heart is formed by the posterior surface. It is formed mainly by the left atrium and a small portion of the right atrium. The base has 4 openings for the pulmonary veins in the left atrium and 2 openings for the superior and the inferior vena cava in the right atrium. Thirdly, the borders of the heart. So we have the upper border, inferior border, left border and the right border. The upper border is oblique and chiefly formed by the left atrium. The inferior border is horizontal, which is formed by the right ventricle and the apex. The left border is oblique and curved, formed by the left ventricle. It separates the anterior and the left surface of the heart. The right border is vertical and formed by the right atrium. It extends from the superior vena cava to the inferior vena cava. Surfaces. First we have the anterior surface, which is also called as the sternocostal surface. It is formed by the right atrium and the right ventricle. Most of the anterior surface is covered by the lungs. Now the posterior surface is formed by the base of the heart. The inferior surface is also called as the diaphragmatic surface, which is formed by the left and the right ventricle, and the left surface is formed by the left ventricle. The crux of the heart is the meeting point of the atrioventricular, interatrial and the interventricular grooves. The heart has 2 types of circulation, that is systemic circulation and pulmonary circulation. So first we'll talk about the right atrium. The right atrium receives venous blood from the whole body and pumps it into the right ventricle by the atrioventricular groove or via the tricuspid opening. External features of the right atrium. The right atrium receives the superior vena cava from the upper end and the inferior vena cava from the lower end. The upper end is prolonged to left to form the right auricle. A shallow groove passes from the superior to the inferior vena cava called as the sulcus terminalis. This is produced by an internal muscular ridge called as the crista terminalis. The upper part of the sulcus terminalis contains the SA node which forms the pacemaker of the heart. Inlets of the right atrium, we have the superior vena cava, inferior vena cava, coronary sinus and the venae cordis minimi. Blood passes out from the right atrium through the tricuspid orifice and goes into the right ventricle. The tricuspid valve ensures unidirectional flow of the blood. Internal features of the right atrium. It has a smooth posterior surface which gives inlets to the superior or the inferior vena cava. The opening of the inferior vena cava is guided by the Eustachian valve. The interatrial septum. It has fossa ovalis, which is a saucer-shaped depression. And the rough anterior surface has transverse muscular ridges called as the musculi pectinati, which arise from the crista terminalis and gives the appearance of teeth of the comb. So these are the muscular ridges which are called as the musculi pectinati. Now let's talk about the right ventricle. The right ventricle is a triangular chamber that receives blood from the right atrium and pumps it to the lungs through the pulmonary arteries. So the blood from the right ventricle goes into the lungs. External features of the right ventricle. It has a sternocostal surface and a diaphragmatic surface. The interior has two parts, the inflowing part and the outflowing part. The inflowing part and the outflowing part are separated by the supraventricular crest. The inflowing part is rough due to the presence of trabeculae carneae and the outflowing part is smooth. Internal features of the right ventricle. It has two orifices. One is the tricuspid orifice which is guarded by the tricuspid valve and the pulmonary orifice guarded by the pulmonary valve. The right ventricle also has trabeculae carneae or the muscular ridges which are of three types, the ridges, bridges and papillary muscles. There are three papillary muscles, that is anteriorly, posteriorly and the septal ones. The wall of the right ventricle is thinner than the wall of the left ventricle. The moderator band extends from the ventricular septum to the anterior papillary muscles. The left atrium. The left atrium forms the base of the heart. It receives oxygenated blood from the lungs. It is more thicker than the right atrium. It pumps blood into the left ventricle by the bicuspid valve. Left ventricle. The left ventricle has three surfaces, that is the anterior, inferior and the left surface. Inferiorly, it has a low rough part and an upper smooth part. It has two orifices, for the bicuspid orifice which has the bicuspid valve and the aortic orifice which has the aortic valve. The papillary muscles are attached anteriorly and posteriorly. Left ventricle is thicker than the right ventricle. It pumps the blood into the aorta and it contains oxygenated blood. The valves of the heart. The valves maintain unidirectional flow of the blood. First, let's see the atrioventricular valves, also called as the AV valves. So we have the left AV valves and the right AV valves. In the left AV valve, it is also called as the bicuspid valve. Bicuspid, bi, which means it will have two cusps. And the right AV valves, which are called as the tricuspid valves. Tri means three, which means it will have three cusps. The valves are closed during ventricular systole. They contain the following: a fibrous ring, cusps, chordae tendineae, and papillary muscles. This is the diagram for valves. So the fibrous ring, cusp, chordae tendineae, and papillary muscles. Then we have the semilunar valves. It comprises of the aortic and the pulmonary valves. They are named because their cusps are semilunar in shape and they lack fibrous ring. These valves are closed during ventricular diastole. Conducting system of the heart, we have the SA node, AV bundle, the right branch of the AV bundle, the left branch of the AV bundle, and the Purkinje fibers. First, let's see the SA node. The SA node is known as the pacemaker of the heart. It initiates a heartbeat. It is located in the upper part of the sulcus terminalis. From here, the impulse travels to the AV node. The AV node is smaller than the SA node. It is located above the coronary sinus. The AV bundle is the only muscular connection formed between the atria and the ventricles. It is divided into left and the right branches. The right branch of the AV bundle, the left branch of the AV bundle, and the last one are the Purkinje fibers. These are large pale fibers and they have double nuclei. Blood supply of the heart. We have the left coronary artery, which arises from the posterior aortic sinus of the ascending aorta. The course, it passes between the root of the pulmonary trunk and the left auricle. It runs in the left anterior coronary sulcus and runs in the left posterior coronary sulcus. The branches of the left coronary artery include the anterior interventricular branch, circumflex branch, left marginal branch, and the diagonal branch. Then secondly, we have the right coronary artery, which arises from the anterior aortic sinus of the ascending aorta. Courses, it passes between the root of the pulmonary trunk and the right auricle. It runs downwards in the right anterior coronary sulcus, runs backward in the right posterior coronary sulcus. Branches of the right coronary artery, we have the marginal branch, posterior interventricular branch, right conus branch, terminal branch, branch to the SA node, branch to the AV node. Clinical anatomy of the heart. Thrombosis of the coronary artery can result in death due to myocardial infarction. Angina pectoris means spasms of the coronary artery. Angioplasty is widening of the coronary artery to remove small blocks. Cardiac pain can occur due to obstruction of the coronary artery. Dextrocardia is when the heart is present on the right side of the chest. Tachycardia is increased heart rate. Bradycardia is decreased heart rate. Arrhythmia is irregular heart rate. Aortic regurgitation can occur whenever there is stiffening of cusps or imperfect closing of cusps. Precordium is area of the chest wall overlying the heart. Palpitations is consciousness of one's heart rate. Pericarditis is inflammation of the pericardium. Situs inversus means reverse of the thoracic and the abdominal viscera. Veins of the heart. Coronary sinus is the largest vein. We have the great cardiac vein, the small cardiac vein, the middle cardiac vein, right marginal vein, and the venae cordis minime.